MS and flukes. Today we're going to be talking about a parasite that is rarely ever explored. It's understood that this parasite is in different areas like Asia and Africa, but it is not in developed countries, and nothing could be further from the truth. This parasite is linked It can be linked to virtually any type of chronic disease. It is found everywhere in the world. It causes a lot of inflammation. It causes cancer. It is linked with neurological diseases. And many of our students that are recovering from different types of diseases like MS, this is one of the parasites that really makes a difference in their recovery. It's a parasite that I have personally dealt with, and today you're going to learn all about it. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis. That was over 35 years ago. I think it's 37 years now. Kind of dates me how old I am. But back in that day when I was diagnosed, I was told, we don't know what causes MS. There is no cure. You're going to have to live on immunosuppressive drugs for the rest of your life. You are going to be completely disabled in time. And there's really, all we can do is try to manage the disease, to slow it down. And nothing has really changed over the past 40 years, which is really unfortunate. That is if we follow standard of care. But today, what I'm going to share with you, and this is part of a series of talks that I've done, research, showing you research, not just the science, but also sharing what our students are experiencing, so you can actually see for yourself. You'll be able to actually see what flukes look like. I'll be sharing an article that I have that I've put together for you, where there's videos where you can actually see what they look like when they come out of people. But this is so important because it's not just for MS, it's for cancer, different neurological diseases. Flukes are so common. We see them in our students because we work with really sick students that have all kinds of terrible inflammation in the body and neurological conditions, cancer, etc. And flukes are incredibly common. So flukes are documented on every continent in the world except for Antarctica. They cause huge inflammation, really strong inflammation in the body. And again, linked to cancer, neurological disease. And we're going to talk about some of the really big gaps in science. And I think that this is probably a big reason why we are not recognizing flukes in chronic disease. So I have been able to live MS-free for over 35 years. I didn't learn about flukes until probably the last few years. So I was able to really manage and treat other parasites, but I don't know if I picked these up before or after I was diagnosed with MS, or if I've carried them my whole life, but I have passed flukes, and boy, they are really pro-inflammatory. So fluke is a type of flatworm. So there are roundworms and flatworms. Today we're going to talk about one type of flatworm. Another type of flatworm would be tapeworm. So tapeworms and flukes are part of the same group, but they're different. So flukes would be shorter and wider. They're flat. Sometimes they look like a leaf. And like a tapeworm could be quite long. It just will be flat and more like a ribbon shape, but flukes may be maximum up to 6 inches long, usually a little less, maybe 3 inches long. They are a little wider, so they will be maybe a centimeter wide. They are rubbery. They usually have a translucent end to them where it's kind of like see-through. And they kind of remind me of like some kind of a little ocean creature that's in you. They're just absolutely horrible. I did a science degree. We might have spent like one sentence learning about flukes, really not covered much in science degree. I didn't do medical, but they're really not acknowledged in developed countries, not something that practitioners would study. There's estimated to be at least 70 different fluke species that are known to live in humans in the digestive tract alone. And it's estimated that there could be up to 50 million people that are infected with intestinal flukes around the world. So different flukes prefer different parts of the body. So you may have heard of liver flukes that generally will live in the liver. There's intestinal flukes. There are also blood flukes, and some of them will enter into like the bladder area and cause the terrible bladder issues that we have. Really, really common in all over the world. It's just not really recognized in many countries. It's called schistosomiasis. So this type of blood fluke can live in blood vessels, so in veins. The eggs can travel through the bloodstream. There are some flukes that live in the lungs. There are some flukes that probably live in the pancreas and other organs. So they sometimes will form cysts, the ones in the lungs, and they could be misdiagnosed for tuberculosis. Also in the brain. So I've been sharing, for example, tapeworm, how the larva of tapeworm can enter into the central nervous system. We call that neurocytocercosis. And flukes can also enter into the central nervous system. So the brain, the spinal cord, the skin, and this has all been documented in peer reports, peer science. So where the fluke lives determines which organs are damaged and which symptoms we have. So when somebody carries one of these species, which is common, the clinical picture is going to vary tremendously. Like if you have liver flukes or intestinal flukes or maybe lung flukes, you're going to have a totally different set of symptoms. So when we talk about the life cycle, this is not just for flukes, but for other types of parasites also. We're told that, for example, with flukes, it's like, the fluke eggs have to go into water, and that's where they hatch. They have to infect snails, and then they will be able to reinfect. So the life cycle is such, the model of the life cycle is such that they're saying that we cannot become infected by fluke eggs, that the fluke eggs have to go through a very specific life cycle where snails are involved. And this is really understood and accepted in the textbooks with, even probably in different countries where they are treating flukes. So they really believe that we can't reinfect ourselves, that we can't, one person cannot infect someone else, that the fluke eggs have to go into water to hatch, to infect snails. That's an intermediate host before it can ever come back to us. And we'd have to eat contaminated fish or snails or something like that. And we're going to talk about how that just doesn't make any sense with our students that are recovering from flukes. So how common are they? The official numbers are almost certainly really low, but the WHO estimates that there could be up to 17 million people infected worldwide in over 70 countries. And that is just with liver flukes. There's another type of liver fluke that we get from fish, eating contaminated fish. Tens of millions could be infected with that. Then there's livestock. So the flukes can infect livestock also. And so they estimate that 40% of cattle in Latin America are infected with these flatworms. And they are present in our cattle too. So unfortunately, we really don't know, but of course we're living in a global environment where, different animals are sent and food from different countries. So when the water becomes contaminated from either our livestock or fish, etc., then these parasites can carry on. So this is something that for over decades and decades we've ignored. And so this is a real problem. So there are literally millions and millions of people infected with flukes all over the world, and our healthcare professionals have no idea. They're not looking for them. They don't have good tests. They don't know how to identify them. They're just told that we do not have parasites in developed countries. It's not an issue. Where our livestock definitely can have. They're present in our lakes in British Columbia. Like, for example, when our kids would swim, we were always told, don't go where the geese are because they're going to infect the water with something called swimmer's itch. And swimmer's itch, I always just assumed it was a bacterial infection where your kids get really itchy after they're swimming if they get this, whatever it is. I thought it was a bacteria. But one year, my son was swimming in the water and he got these huge welts on his leg, like really big. They were like about that big, and many of them. And so we went to the doctor, and the doctor's like, oh yeah, that's swimmer's itch. And it wasn't until, this was years and years ago when he was young. And then more recently, like as I'm studying this, I did some research, like what is swimmer's itch? What is it caused by? It's actually caused by flukes. So they're saying that these flukes are in Asia and in Africa and in far off countries. They are in our lakes. So like you could be swimming in the lake and accidentally drink some water and you could pick up Giardia, you could pick up other parasites, but you could also get flukes. And so the swimmer's itch would be more of the hatched larva that is going to try to burrow its way through your skin, and hopefully your immune system will get after them. But if it doesn't get after all of them, then they set up camp in the body, and that's where the infection can start. And it could take decades and decades before we really have a lot of serious symptoms with that. So every textbook teaches that the fluke cycle has to follow this model where eggs leave the body of the infected host through feces. It has to reach fresh water. It has to infect a snail, and then it emerges it hatches into a specific type of larva, immature form, and then it can infect humans or other animals through food, water, or through skin contact. So that would be like even swimmer's itch in lakes and in, I don't know if rivers but for sure lakes. So this is what our medicine is built on. And it's really important to understand this because they're saying, no, you cannot like carry on an infection. Like if you have a fluke, it's going to live in you for a certain number of years. It's going to die. You're going to pass it. And you cannot become reinfected unless you drink some more water that has the hatched larva, or you have them burrow through your skin, or you eat fish that's contaminated with the larva. So it is really interesting that this life cycle is set this way. So we'll come back to this in a minute. But when you trace this model to their sources, which I have done, because it doesn't make sense to me, because the students I work with that have MS, ALS, Parkinson's, they are heavily infested with flukes, and they're passing really large ones. Like if we're dealing with intestinal flukes, it could be up to maximum we've seen is 5 or 6 inches long. And then sometimes they're passing smaller ones. They're not drinking unfiltered water. Their family has been treated. Like they don't have a way of being exposed to it. They're not eating raw fish. They're not eating like plants that are in infected water. So like, how have they become so sick? And so I started doing research, and you can do this yourself. So I went to different places, like many different places, like different medical databases, and trying to find articles, and then even using AI, some of the research-based AI, and saying, can you show me one study that shows that the eggs of flukes cannot hatch in the host? And they're like, and it just quickly would go off like, no, this is the model. This is the accepted model. I said, yes, I know that's the accepted model, but please show me a study that shows that the fluke eggs cannot hatch in the host. And there's not a single study that shows that fluke eggs cannot directly hatch in the host. This is really significant because if it hasn't been shown, and they could do this easy enough, they could take germ-free mice or rodents or animals, and they could infect them with the eggs of flukes, and they could, make sure to clean up their feces so they're not going to reinfect themselves. But like to see, like, does this germ-free mouse become infected with flukes or with roundworms, they don't do this for any of the worms. They just have these, the WHO, the CDC, they have these established life cycles, and they're not basing it off of science. This is not science. So that makes a huge difference, because if fluke eggs can hatch in the host, then we can have reinfection, right? We can be having them, they do lay thousands of eggs in a day. I've seen, up to like hundreds of thousands of eggs in a day. So like that's really huge. Or I should say even like 20,000 eggs per day. I've seen 200,000 eggs per day. These parasitic worms are so understudied, it's not even funny. So anyhow, if you just say thousands of eggs per day, some of these flukes can carry like almost 30 million eggs in an adult fluke. And so they're just infecting us with eggs every day. And if we have a really robust immune system and it's not bogged down by anything, then maybe it will catch it right away. But if it doesn't, then what if these eggs can hatch inside of us and then we become more and more infected in time? And that's what we see with our students. So again, in science, they have never proven that I can find, if you can find studies, please let me know, where they have shown that you take a sterile animal that has no parasites and you give them fluke eggs or roundworm eggs or tapeworm eggs, and those eggs cannot hatch under any circumstances in the host. That has never been proven. So that opens up a whole different field here. So then we could, if it's true that they can hatch in us, then if we are, let's say, not washing our hands well, we can reinfect ourselves, or they can just keep hatching inside of us and perpetuating the infection, or we can pass the infections from one person in our family to the next. So these are really, really important questions that need to be answered as soon as possible. And even just the fact that they're so common and they're not studied at all, they're not recognized as a potential cause for all kinds of inflammatory conditions, including cancer. And I wanted to share here before I forget that I found 3 studies that show that fluke eggs were in the center of gallstones. So if that is the case, then how many people with gallstones have flukes? How many people that have had their gallbladder removed has just had a fluke infection and they lost that very important organ when they could have kept it if they would have been treated for parasites, if the flukes would have been treated. So we know that the flukes really like to live in the liver gallbladder area, so it would make sense that some of their eggs could cause the formation of gallstones, and that's been scientifically validated. Make sure to send or type your questions in the question box, and I will answer your questions as I go through here. So we answered those questions, which are really, really important. Another really understudied that I have, and I'm going to continue to study this, is that they say, well, flukes can live for like anywhere between, up to 20 or 30 years. Some of them might live 5 years, 10 years, but they could live up to 30 years. And it's like, you have to ask the right questions. So then you're like, so is it that the infection can carry on in a host for that many years? Or have they shown that the adult can live that long on its own? And this is another really understudied area. So this is everything I'm saying here is an estimate as far as how long they can live. So, if they can live even 5 to 10 years and they can produce, like, they can release like millions of eggs, like that is a really big problem. That's what makes them more challenging to treat. So all of this matters tremendously because the absence of this evidence is showing that this is not scientific. This is not validated in science. So these studies are not there, and our student experiences that when they're recovering from chronic disease is that they have many, many worms, and let me backtrack. There's another assumption in a lot of literature, like you might go to pdr.net, you might look at some other pharmaceutical websites, and they talk about, treating flukes. It's like 1 or 2 doses of praziquantel, and the count is pretty much normal and people are fine. We don't see that in chronic disease. So maybe in Asia, if a child just got an acute infection, maybe a acute fluke infection, it's possible that if they just had, let's say, 1 or 2 doses, because they're literally catching it immediately, that might get rid of the infection. But when people have chronic disease like MS, ALS, Parkinson's, PLS, and even people that they're trying to figure out what's wrong with them, the doctors haven't figured it out yet, but they're just so sick. Flukes are involved very, very often. And when they're treating, like somebody who doesn't even have a diagnosis, they may treat for months and months over cycles, and they're still passing flukes. They might be feeling better and better all the time, but they're still passing flukes. So the whole treatment protocols in chronic disease are, in our experience, are completely off. And then again, that might be something for somebody who just literally got an infection. They figured it out because maybe in a country like Asia, they recognize it quicker and they treat it more quickly. But in the developed countries where we're dealing with chronic disease and we have had maybe chronic infection for years, we do not recover with like 2 doses, like 2 days, 1 or 2 days of using one parasite drug like praziquantel. It just doesn't even do anything. Like you might pass a couple, and people can't even tolerate to start with the parasite drugs right away. They need to first get ready to treat, and then we treat over many, many cycles, and they keep releasing these worms, these flukes, and also other worms. So the symptoms that people can experience from flukes in their body, the list is really broad and multi-system, multi-organ, large, non-specific. So like things like edema, where you can have swelling in your ankles. And how would you ever connect that to flukes? But across all fluke types, just in a general sense, is that we see patterns of extreme fatigue, debilitating fatigue. That's one. And of course, it could be for other parasites too, but it is definitely profound and often debilitating fatigue. You can have a low-grade fever or intermittent fever. And then also, this is not common in our students because they've probably had it for so long, but eosinophilia, which is a certain type of white blood cell that is usually a white blood cell that goes after parasites. The eosinophils could be elevated, but in chronic cases, we don't see that. Also, all kinds of skin reactions. So this is where we have like the allergy reactions. So hives, generalized itching, anemia, cognitive impairments like brain fog, really big mood disturbances, depression, anxiety, and then neurological symptoms like what we've seen in our students, that they're really linked with like muscle spasms and spasticity, like just feeling hopeless, like the mood where you're just like feeling really depressed, like you just can't handle life anymore, burning and tingling sensations, headaches, dizziness, vertigo. This is, maybe it's just because I've experienced them, but they are the nastiest parasites. I feel they are, but I do work with students that have a lot of roundworms too. They have really big Ascaris roundworms, and of course they can cause symptoms, but the flukes are almost like the next level. They are much, much more pro-inflammatory, I think, in a general sense. They can affect our liver. So they definitely, like if we're treating, or even before treating, people may notice that they have elevated liver enzymes. So the liver and the bile ducts are impacted, where we can have pain in that area, kind of right under a rib cage on the right-hand side. And we might have some jaundice. We might have where we look like, and I had that a lot in the winter, where people, it could have been partially the vegetables I ate too, because I ate a lot of vegetables, but also because I had flukes. It's like you have this little bit of a suntan. You can have yellowing of the eyes. You can have gallstone issues, recurrent infections, fibrosis. And then other ones like bile duct cancer, so really linked a lot with the cancers. And I also saw one study for sure, and I'll continue to build on this, is that fluke eggs have been linked with certain tumors, and I think that was in colon cancer. So one type of species of fluke is a group 1 carcinogen, and it is classified in the same type of carcinogen as cancer-causing agent as tobacco. That's one type of fluke. So with the intestines, we can have malabsorption, protein loss, we can have B12 deficiency, nerve damage, electrolyte imbalances, muscle spasms, spasticity, it's a B vitamin, thiamine deficiency, myocarditis in some species. So you wouldn't even think myocarditis could be linked to flukes, blood flukes. So that's if they're in the intestines, those symptoms. But if we're talking about blood flukes, portal hypertension, and then we have bladder cancer, spinal cord and brain involvement. So they're awful. Lungs, chronic cough, blood in sputum, seizures if flukes reach the brain. So it's not just tapeworm larvae, but if the fluke larvae reach the brain, they can cause seizures also. So this can be another reason, like if we're not even in the game of looking for parasites, not even appreciating they could be involved in chronic disease, then we're never going to get to a cure. And we are just, we might learn about, tapeworms can cause seizures, but and I'm sure roundworms can too. It depends where the larvae end up in the central nervous system, what inflammation they cause on which nerves. So in the wellness champion community that work with us in the Live Disease-Free plan, we see a lot of things like MS. They're really common in MS, or people that are dealing with a lot of neurological symptoms. They feel they may get an MS diagnosis soon. Fibromyalgia, autoimmune conditions, chronic fatigue, where they're really exhausted and they're super inflamed, and it's affecting different parts of their body, many different parts of their body. It varies so much. It can even be, making people feel like they're choking, where they have the GERD and causing so much inflammation. Of course, that is linked with H. pylori also, but it can just, the inflammation can vary so much throughout the body, but it is really, really significant inflammation. Why are they so hard to clear? Well, number one, if we just accept their model, the life cycle model, which has never been proven in science, that I can see, again, please share with me if you're a researcher and you've got studies that prove that eggs cannot hatch in a host. But, with them carrying, like if you, let's say, had 10 flukes in your body and they can lay 200,000 eggs in a day, hundreds of thousands of eggs in a day, and some of those are hatching, like your immune system is trying to keep up with keeping them under control, and probably some of them are passing out of your body, but you can see how this can be a really big problem. So let's say somebody had Lyme infections, right? Or maybe chronic malaria or chronic Borrelia or something like that, or chronic fungal, and so we just don't study flukes, roundworms, flatworms, tapeworms, as far as, how their life cycle could continue, especially in immune compromised people. But when we look at the potential lifespan of, 5 years or longer that they can live, and then we look at how hardy they are in the body, we look at how prolific they are with laying all of these eggs, and then if the science hasn't proved that they can't reproduce inside of us, what if they can, right? And that's not even, us not washing our hands, that's them being able to reproduce. So we haven't proved that. So it's very, very possible that they can. So one worm over 10 years releases hundreds of millions of eggs, which is insane. So, and then the immune activation. So we're dealing with chronic inflammation when we have flukes, and they're not just invading our body, but they are also really impacting our immune response. So they're pushing this inflammatory immune response pattern that is associated with allergies and chronic inflammation. They are just so common in chronic disease, and they are so nasty. They're just awful. So standard stool tests are really, really poor. Number one, in developed countries, we're not even looking for worms. I've had so many students where I don't recommend our students to get stool tests, because I know that the standard stool tests are not even looking for worms. But especially flukes, because that's considered to be something in Asia or something in a far, far away country, exotic country. But the World Health Organization says this is a really neglected parasite. So by the time someone reaches our program, they have been sick for decades, and they've been dealing with this, and they've had continual, the infestation has been growing, and they're dealing with multiple parasites, not just flukes, but flukes, I would say, in my experience personally and in experience working with thousands of students all over the world, they would be the most pro-inflammatory at this point in time with the research that I've done. So recovery is possible. Oh, I wanted to share too with you that if you would like to see pictures of flukes, I've got pictures, I've got videos. So some of the pictures the students are passing, you'll notice that they may not be looking exactly like I do have one image that I found where there's a bunch of flukes in an animal, like I think it's an elk, in their liver, and they're really intact. So when our students are treating and they are using an oxidizing enema, so the oxygen is killing the fluke, and then they might not do another enema till the next morning, and then that, the hours in your body starts to break them down. But some of them are more fleshy and intact. Some of them are a little bit more digested by our body, but you really get the idea of what they look like. They're not tissue. They are not intestinal tissue. They are rubbery. They're just nasty. So if you would like to get all of my notes that I'm sharing with you right now, and if you would like to actually look at pictures of them, then make sure to direct message me on Instagram, the word fluke, or if you're on Facebook or YouTube, just comment the word fluke, and we will send that over to you. We'll send the link over to you. That'll happen after this event. So this is something that I didn't even know about. Years ago, when I started coaching, we knew about fungus. We knew about candida. Decades and decades of, years ago, doctors were writing books about how candida is more common in MS and other chronic diseases. Then we started to learn about the Lyme infections, Borrelia, Babesia, Bartonella. There's many different infections that travel together. They're called vector-borne infections that are associated with Lyme disease. Then, thanks to the work of just a very small number of, I call them hero practitioners that understand this, we started to learn about worms. And of course, at first it was tapeworms would get more attention, and roundworms. And then we started to see in our students and recognize the flukes. And now it's so common that I see flukes. I have a library of images of different types of worms, thousands of pictures. So what we're going to do just in the next month or so, if you are a practitioner and you would like to learn more about how to identify parasites in your patients, how you would treat them, how you would build a treatment plan, which kind of treatments are going to be most helpful. That is something that I have been researching and working with students. I'm not a practitioner, but our students I've been helping them to build treatment plans, working with their practitioners. So I'm an educator, and we have an incredible system, and we have insights that would take decades to gather, to learn, because we're doing things that are not necessarily known even in integrative health. Unfortunately, that's a really sad thing. So make sure to go to livediseasefree.com. Make sure to, connect with us there so that you're on our list. You get our newsletters. You'll hear about this. It'll be like a one-day VIP day, which is going to be, I'll be sharing more about this soon. It'll be probably in June will be the first one. It'll just be like a Friday. It's only for people that are doctors, nurses, clinicians. It's not for health coaches, because this is more for practitioners that are going to prescribe and to treat the parasites more effectively. Like, this has to happen because it's just ridiculous that I have people coming to me all the time and they're like, I can't find a practitioner even in the United States that knows how to treat worms. They know about candida, they know about Lyme disease, but they don't know how to treat worms. So, if you are a practitioner, reach out to us, info@livediseasefree.com. We'll put you on the list. It'll only be like a group of maybe 10, 15 practitioners to start off with, but I may offer that more often. I'm just really excited to get everything that we've shared to practitioners so that they can help more people. So we can refer more people to them. So recovery is possible, but you can't just start treating. When you are super inflamed and you're super tired and sick and you just feel like you're dying, number one is to follow the Live Disease Free diet. All the guidelines are free on our website, livediseasefree.com, or you can just message us diet and we'll get you the diet link, and then follow that first. When you decrease their favorite source of energy, which is glucose, sugar, and also carbs. So any type of carb that breaks down to sugar in the blood feeds all kinds of worms, and including flukes. So when we get the carbs low enough, we notice significant reduction in inflammation. So this is a natural way to modulate the immune system, to support the immune system. We're not doing anything to it. We're taking some of the pressure off of it. So make sure to start changing your diet. And then what you can do from there is getting ready to treat. We make sure we're having daily bowel movements. We make sure we're sleeping well at night. There's things we need to do, cleaning up our environment. And then what's also really helpful at this point, because we don't have good parasite tests, is that there's more and more opportunity for being energy tested by clinicians. So I'm seeing that there's more instruments that are available on the market for integrated practitioners, where before it was like just muscle testing, and now there's machines that have, I believe it's the frequencies of many different parasites just put into the machine, so they can actually, just by hooking up electrodes to you, however the instrument works, they can actually pick up certain parasites. So whether it's, protozoa, whether it's bacteria, fungi, or these different types of worms. Again, it's a growing field. It's really helpful. It's a piece of evidence. But then we also look at what we're passing. So our students are doing these oxidizing enemas, and that is incredibly gold, because they're passing these worms, because some of them make their way down to the large intestine. They usually like to live in the small intestine. And so when you hit them with this oxygen water and then they come out, they're dead. And our students will lay them on tinfoil or parchment paper, put a ruler or tape measure beside it, take a good clear picture. And they're very characteristic. The flukes are. They're very different than tapeworms would be. They're very different than the roundworms, very, very characteristic. So then with the 5 or 6 criteria we use is, like, we look at our health history, the health history of our parents, we look at our symptoms, we look at diagnoses we've had, energy test results, and also what types of worms are we passing. So then there are specific protocols that we use for treating, and the students will do cycles. And if somebody is, let's say, doesn't have a diagnosis yet, really high functioning yet, not disabled, they may still have to treat for 6+ cycles, and they're approximately 4 to 6 weeks per cycle. And so we're hitting big to small parasites, because we know this talk is about flukes, but we know when we're out of balance, it's not just one parasite. We're dealing with fungi, bacteria, protozoa, and worms, and it's probably not just one type of worm either. So we want to use a layering therapy of the parasite drugs and herbs and these oxygen type therapies over multiple cycles, and we just keep working them down and making sure we have good hygiene, making sure we're not getting reinfected in any way, and treating our family, not necessarily for what we're dealing with, but we should all treat parasites at least once a year, just like we do with our pets. That's the reason I believe why we're so sick, is because we have neglected parasites. And a parasite is any microbe that lives in your body and causes you harm. It's not just parasitic worms. So this is definitely doable. This is definitely, we can recover from them. We just have to understand and appreciate, the sicker we are, the more infested we are with these parasites and the longer it takes to recover. Although we keep learning more and more efficient ways to get them out of our body, but it's really important to do the prep work first so that you can tolerate the treatments. I'm going to go to your questions right now to see if you guys have any questions. So Tiffany's asking, do flukes cause more intestinal symptoms than other parasites? Yes, they can cause a lot of pain in the intestines for sure. Absolutely. You can just even Google search and you'll see that they can cause a lot of stomach pain. The crazy thing is they don't have to, and I don't understand that. I don't know why in some people they do and some people they don't. And it could be that the other parasites we have involved, it could be that the load that we're dealing with. But yes, they can totally cause a lot of pain in the gut. But the thing is, they'll cause the pain in the gut, but then they cause generalized inflammation throughout the body also. So what is a fluke? A fluke is a flat worm. So it is wider and shorter than, let's put it this way. Roundworms, I call them like spaghetti noodles, right? They're long, they're kind of round, and they can be anywhere from 2 inches, 1 inch. They can be 2 feet long. They can be over 2 feet long. And then tapeworms are longer and skinnier also, but they are flatter. They're a little bit wider than a roundworm, and sometimes they have segments, but they're look more like a ribbon. So they're flatter and a little wider. The roundworms are just like a spaghetti noodle. Maybe the tapeworms would be more like fettuccine noodle. And then the flukes they would be no more than 6 inches long, usually like 3 to 4 inches or 1 to 2, but 6 inches would be really a mature intestinal fluke. So, and then they would be probably up to like less than 1 inch wide. So they're shorter and they're wider, they're rubbery, they're translucent. They're all the worms are cream colored usually. So if you are taking herbs and you're passing worms and they look black, it's probably because you're using herbs like black walnut, which will stain them dark. Or if they're older parasites, they can look darker also. But if they are, actively living and you are treating them with, let's say, the parasite drugs and you're doing enemas, and they come out looking more kind of a creamy white color, those would be more of a fresher living parasite that just was healthier and just died more recently. So I'm trying to think what they would look like. You'll see them if you type the word fluke. We will definitely send you the link for my notes and videos and pictures, and you'll see they're kind of rubbery and fleshy. They're not like mucus. They're not like biofilm. Of course, your body does, if they're in your body, for a certain period of time, your body will break them down eventually. But when they're quite fresh and new, they really are easy to tell what they are. So diet is really, really important. What parasites are more common in MS? My Miracle is asking. So I actually have a PDF. I'm trying to think what the word is to message me. I don't know. If you do research, we'll probably be able to figure it out. MS research maybe, and we'll send you the link for that. And it's just a 1-page PDF that has a lot of links to the various types of parasites that are really commonly associated with MS and other chronic diseases too. So number 1, Candida, that's been known for many decades, that Candida or mold is going to be involved with MS. I've done a many-part series on a type of protozoa, which is a malaria babesia type protozoa. So maybe My Miracle 79, you have not seen all of the different talks I've been doing over the last few weeks. I've been going through the main categories of the parasites. And so that protozoa that is, it's something that infects your red blood cells. That's really commonly linked with MS. And now multiple sclerosis is being considered more of a vascular disorder than an autoimmune disorder because of, and I talk about all the science behind that. And so that's a type of parasite that would really impact our red blood cells and our blood vessels and cause the vascular disorder that they're seeing in MS. But not to say these other parasites can't also. But I did a 6-part series on that years ago, but I did a more recent, just updated one just a few weeks ago. So I mentioned the Candida, I mentioned the protozoa, also bacteria. One that's really commonly linked with MS is Borrelia, which causes Lyme disease. It's so common that the MS Society just doesn't even know how to distinguish, or they were very confused about distinguishing MS and Lyme disease. They did take that down from their website, but I did take a snapshot of what they had on their website. They basically said, you know, the MRI looks the same, all of the pathology looks the same, the symptoms can look the same, but they're different, right? And then they went on to talk about how antibiotics don't work in multiple sclerosis, but then in one of their studies, antibiotics early on, like when somebody's had the first attack, it was helpful for quite a number of people. So that is one. That is not the only cause, but it's common in MS. And then with our students that have MS, they are passing, I would say there's a subcategory of MS where they're passing a lot of really big roundworms, really big, and many of them, like 2 feet plus. So it's really neat, the work we've been doing. It's really coming together, like the insights. I believe it's by the grace of God we're doing this work. And that's why it has to be shared with practitioners. We have to get this going. We have to get people or practitioners that they're not getting this in their education in the medical or even in naturopathic. They're not learning about this at all. So I did a talk just a few weeks ago about large roundworms in multiple sclerosis. Make sure to look for that one. You can find all of these blog posts on livediseasefree.com, the previous ones, livediseasefree.com. Go to the blog where you'll see all of the articles there. You can scan my notes. You can listen to the shortened video while you're cooking or whatever. So we talked about roundworms, but then tapeworms also are really common in MS and other chronic diseases. So Dr. Alan McDonald found tapeworm larvae in the spinal fluid of every MS subject he tested. So again, the worms will live in the gut, and then over time we get too many of the larvae, they move into the central nervous system and they start to form cysts there. This can be from flukes, this can be from roundworms, this can be from tapeworms. It can be from any type of these different parasites. Just going to grab some water. You're very welcome. So, Joe Bird, 63, can flukes also cause restless legs and also morning headache and migraines, additional hot flashes? So I can't say that flukes are causing all your symptoms. You really don't know, because like different parasites can cause hot flashes. It's like, just follow our system. Like, it's first getting ready to treat, and then we have, you can be energy tested. We look at the symptom, we look at all that criteria so that you can build a treatment plan. And then from there, we don't just treat one parasite. We do cycles where we're treating from big to small over multiple cycles. So you will have worms, probably different types. You will have bacteria, you will have protozoa, and you will have fungus. When you have chronic disease, you have all of them. And so you're just knocking them back, building back the good, and you feel better and better and better. And the exciting thing is that people can have so much more recovery than they ever thought possible. Go to Live Disease Free on YouTube, watch the successes there. We have a playlist of successes. Also on our website, livediseasefree.com, we've got lots of successes there of students that have been in wheelchairs before, that are walking again, we're getting on to 10 years now, where some of the students 10 years ago found us and they are living their life. They're still, some of them have gone on to start clinics and like helping health clinics, writing books, starting podcasts, fitness trainers, starting health food companies. When you get your health and your life back, you want to give back to others. So it's really exciting. Fluke, F-L-U-K-E. Thank you, Carmen. Let's see here. Yes, all of those symptoms, Joe Bird 63, they're all caused by various types of parasites for sure. But I just wouldn't say that there's one parasite that's causing all your symptoms. It's called dysbiosis, D-Y-S, dysbiosis, and that is really where we're at when we have chronic disease, when we have a lot of different types of symptoms. Think about like your garden. When you have a garden, you know that you don't just have one type of weed growing in the garden. You have multiple different types of weeds that grow in the garden, and you keep getting rid of them and pulling them out, and then a week later, more of them are sprouting. And that's what we're dealing with inside of us, is we're dealing with multiple types of pathogenic disease-causing parasites that are out of control. There was a time in our life when we took too many antibiotics, and that put us out of balance. It could have been when we were very young. And also lifestyle will make things worse. Pregnancies will make things worse. All of these things are the hormone fluctuations that we deal with as women can be difficult because the parasites will benefit at certain times of the month. I'm just going to quickly finish off with talking about treatment. In our experience, so you can go to pdr.net and you'll see like treating, or just even research like treating flukes, and they'll say, oh yeah, like 1 dose or 2 doses or maybe 3 days and it's cleared. It's like that has not been our experience for a single one of our students. It's been, many cycles of treating, and of course they're feeling better all the time, but it's not resolved that quickly. So there's a big disconnect in that research also. There is no single parasite drug that probably gets rid of all the flukes. That's not what we're seeing. We're seeing that combinations of the treatments with herbs plus the oxygen type therapies all together is what's doing it, is what's moving the needle. So some of the common drugs, again, this is for educational purposes. I'm not telling you what to take, but praziquantel would be one that would be really important. And then things like albendazole, and you have to work with a practitioner. If you have some of these in your brain and you don't know what you're doing and you take the wrong amount, and some of them, these parasite drugs cross the blood-brain barrier, practitioners are worried that you could have a deadly Herx reaction in your brain where you can have seizures, right? And it can be fatal. So this is why I'm saying that talk to your doctor about this, or talk to us about this. Like if you want more like education as far as how to recover, that's what we do in the Live Disease-Free Plan. We teach people what they need so they are equipped, so they know how to recover and they can get the help they need. So praziquantel is an important one, and albendazole is also important. Albendazole is not a primary fluke medication, but it is definitely helpful. We have to consider the life cycle, like the adults versus treating larvae versus treating eggs. The parasite drugs, they don't all treat all parts of the life cycle. So albendazole is helpful. There's also triclobendazole, especially if you're dealing with liver flukes. Talk to your practitioner about that. And then there is albendazole is good. And then parental palmate would be something secondarily helpful. It's not a primary, but we have found that it's really helpful. And then even adding in things like raw garlic, chopped up raw garlic on a spoon. And then in certain countries in the past, they've used standardized extractions of myrrh. That is a herb. So myrrh has been shown to be helpful. But if you just buy myrrh capsules, you're not going to get rid of flukes, unfortunately. If it was that easy, trust me, we would tell you, but it's not that easy. So there's other herbs that could potentially be helpful, like black seed, or like if you just do some searches, you have to really know what you're looking for. You have to actually look at studies, because a lot of times AI will give you incorrect information. But the key is that in our experience, whether it's, when people start to get to a place where they feel really sick and they're dealing with chronic disease, whether it's MS or other, that they have a very heavy parasite load, And it's not just Lyme disease. That's the thing. Like a lot of practitioners like, oh, you have Lyme. And if you just focus on treating Borrelia and you don't treat these bigger worms that are tens of thousands of times bigger than bacteria or than protozoa, you'll never recover. And then Dr. Alan McDonald has shown that some of these worms, they do carry their own, like Borrelia. They're infected with their own bacteria and other parasites, so they're infecting us. So you can be treating Borrelia, and then you've got filarial worms in your central nervous system that it's continually infecting you with Borrelia, and you're not getting better. And it's like, is the treatment not working? Is it that Borrelia is not your biggest concern? Maybe you do have some Borrelia, maybe it's showing up, but maybe it's not what's causing all your symptoms. This is what I need to get to practitioners so that they can actually help people in a much more effective way and have some skill at this. It's ridiculous that it is at this place. So again, getting ready to treat, that's the really important part of the Live Disease-Free plan. That's what makes us really unique, is the understanding the importance of preparing before you treat parasites. It's vital. It's vital for you tolerating treatments. It's vital for recovery, for effective recovery. And just know that there is so much recovery that you can have that you never thought was possible. That's what we're seeing in our students. People that haven't used a hand for like 40 years, it's been clenched. And then all of a sudden one morning they wake up and it's like open. And then they can start moving it, and then they start doing physio, and then they can shave their armpits, and they can use it for different things. So it's so incredibly exciting, and this is why this has to move quicker. A couple last questions here. So you had 21 years of antibiotics, Chris. Yes, that is a definite sign that you will be very susceptible to different types of parasites. So Louis Pasteur admitted on his deathbed, it's not a bug, it's the terrain. Make the environment for the critters uncomfortable and don't feed them sugar. Christine, I wish it was that easy. Of course, we do change the terrain. So we are changing our diet. We are working on our lifestyle. We are getting rid of toxins in our environment. We are reducing I won't say what the names are because I don't want this to get censored, but we are doing all of that. But they will never leave your body. I think we're more susceptible to parasites through all the things we've been through, but they will not leave your body until you treat them. We're the host. Like biologically, ecologically, they love to live in us, right? It's just that we lost our natural defense. Our body, our immune system has been burdened with a lot of different things and has made us more susceptible. They've been ignored, but they will not leave your body unless you treat them. But I'm all about changing the terrain, absolutely. So how do they treat them in third world countries? They treat children in school, very young children, like when they're in kindergarten, in grade 1, they yearly, at least once a year, they deworm children. We do not deworm children in the developed countries. We don't deworm adults. We don't deworm children. I've just heard from somebody recently, like their child is probably about 6 years old in the Philippines, was given a dose of albendazole, right? So they keep up with it. They recognize it. They are protecting their people. We don't do that in the developed countries because we have these very lucrative industries. And unfortunately, there is no incentive to treat the root cause in the developed countries, and that has to change. So we have to definitely make the body support the immune system so that we can recover, because when you start treating them, if you're not ready, you can feel absolutely horrible. Some people are not even able to treat because they're that sick. Those are the people I'm working with. And I just shake my head. I have never seen people this sick before. I've been doing this for 10 years, and they are definitely a lot sicker than they were 10 years ago. So number one, if this is the first time that you found our work, make sure to if you want to learn more about flukes, make sure to comment the word fluke and we will send you the article. You'll see pictures of flukes. You'll see actual short videos of them floating in water, what our students have passed. And then if you are like, okay, Pam, I've been following you for a while and I just really want to treat parasites. I believe I'm dealing with this. I've been looking for practitioners. I'm not able to, figure out how to do this. I need a plan. I need a proven plan. I need support. Then make sure to watch my masterclass training. The link will be just above or below this video. And once you watch that, if you would like to possibly work with us in the plan, then you can fill out the form and you can book a time to chat with me, but make sure you watch the Coachathon first because it'll tell you all the steps we take in the program so that you'll know how to recover. You'll have better questions for me and I'll meet with you before we get started and I'd be honored to support you. So, and I just wanted to share an amazing success from one of our students before I go quickly. We have a preteen child who in January was hit with a debilitating attack from playing tennis to going into a wheelchair. And this was the beginning of January 2026. And then by right now, that child is playing tennis again. So she spent a month in the hospital and now she is completely MS. She got an MS diagnosis. So she was in the hospital in a wheelchair, got an MS diagnosis. Doctors were like, oh my gosh, this is what's going on? She's doing terribly. They wanted to put her on MS, disease modifying drugs. Parents found me and her doctor's been helping them to treat parasites. And she is back to tennis matches, not just struggling to play tennis, but she is back to tennis matches. Children are very resilient. She's passed a lot of parasites. You'll see if you're connected with us on Instagram and Facebook, you'll see the carousel of her success. It's pretty remarkable. Please share it far and wide for parents that are frantic. Like the parents, when they talked to me in January, they were she said, I didn't have any more tears left. I was so lost. And then she said, Pam, you talked to me and you were just so calm. You're like, yes, she's going to play tennis again. And that just gave them hope. And they started looking into it, made sense. They started following the plan and they have their daughter back and she's going to have a beautiful, long, healthy life. And now she hated vegetables before and now she's telling everyone they should eat more vegetables. So with that, I hope you guys find this helpful. Make sure to like, share, and subscribe. That's the only way this information is going to get out to others that are desperately looking for it. Send us the word fluke or watch my masterclass training. And I would love to support you and change your diet. And you'll find that, again, you can just text the word diet or message the word diet, comment the word diet, and you'll get that. Until next week, we'll take care and bye-bye for now.